It's such a pleasure coming here from America all the way to Switzerland to see you and meet you and learn from you. And I just cannot believe that I'm actually sitting with you and have this opportunity so you can share with me what you did in my country in 1959 when the oil poisoning came. And actually you are actually one of the first occupational therapists in Switzerland that were trained by Americans. And the irony of all of this is that the oil poisoning in Morocco was caused by some oil that the American left there as a result of the Cold War. And after when the oil was left, actually was sold in the market and it was used for cooking, and what led to some neurological disorders in tens of thousands of people. After that, the Red Cross intervened with the WHO and sent healthcare workers to Morocco from all over the world. And regarding occupational therapy, there were only 5 occupational therapists who went there, 3 from Switzerland and 2 from Canada. But the first occupational therapist ever to step a foot in Morocco was Hanny Brun, and she is was one of the people who saw and witnessed the devastation result of that disaster, and she's going to talk to us more about it and what exactly she did there. So the question one is, so tell me about the oil poisoning in Morocco in 1959 and how you were chosen to help with the recovery.
Mm-hmm. Well, we heard about the Red Cross of Switzerland. I think it was international. Mm-hmm. And they were asking whether there is ODs mm-hmm. who would go to Morocco and find out what could be done, treatment or whatever. And so I was asked by Dr. Zinn. He was one of the leading doctors of our group, and he said, I only go if I can have an OT with me.
Did you listen to this? Only, this is a major doctor here in Switzerland, and he wasn't one of his conditions to go there, that he, and Hanny told me this yesterday, and I want to put this in the record, that he can only go if there's an OT with him. That's great. That's amazing.
And in Switzerland, OT had just begun. Mm-hmm. And I even can't remember whether the school was already mm-hmm. in function.
Yeah.
But we, a few people, had very good courses with 2 Americans, OT, who were bosses in polio center in America.
In America, okay.
And they teach there muscle testing and all these kind of things, splint making, and so I felt that maybe I have enough knowledge to go and see what is about with these patients and what can be done for them. Mm-hmm. And so I was the only one from Switzerland to start this therapy, and in the beginning it was mostly muscle testing, because all the people needed a paper signed by a medical doctor that they have this lesion okay. because of the oil poisoning.
Okay. And when you were there for almost 4 months, just to add this to the record as well, this is I mean, our roots start from nursing as well. Hanny was a nurse initially, and she became an OT, one of the first, if not the first OT here in Switzerland.
At the beginning,
Yeah.
it was mostly to test the
Testing.
hands.
Okay.
The physios, they were testing the legs and the feet.
Okay.
But the hands I was testing,
Mhm.
and it was very uniform. They had all the same lesions. Interossi and lumbricalis, the small finger muscles,
Yeah.
and some of them, some flexors, which were paralyzed, but otherwise the upper arm was in a good condition. And so they had the thumb outside of the hand,
Yeah, I know.
really,
Yeah, yeah.
because they didn't have a good adductor.
Ah,
So I was making
abductors.
splints from plastic.
Yeah.
We received the material from Switzerland,
Mhm.
and I must say I had a lot of help by the boys from the orphan
Orphanage.
house at the next, and they were filing the splint so it didn't hurt the
Hurt people.
patient.
Okay.
And then I had to warm it up and try to
Fit.
each patient,
To
it
fit
was
it.
made separately.
Mm.
And this was what we called an opponent splint.
Yeah. So opponent. Yeah.
Yeah,
Yeah.
yeah. And then that was the first thing we did. So the thumb was in a good position. It was 2 months or 6 weeks or maybe
beginning,
more
yeah.
until I was thinking about functional training,
Functional
because there were too many
People.
to make muscle tests, and
Yeah.
until we had an idea what could we do
Yeah.
for functional training.
Yeah.
With the men it was more difficult because professionally the men had all heavy work to do,
Yeah.
and this was difficult to find how and what they could do. But with the women, Kemi said is a wonderful place for carpets.
Carpet waving.
And I have been to the souk twice and looking what they did, and then we asked specialists, also the women of the Mokadem,
Yeah.